Hey team, it's Dr. George here, and I wanted to talk about a letter that was recently published in the Journal of HIV Medicine. And they're talking about men who have sex with men and the association with coronavirus. Basically, what they're saying is that we know that coronavirus is passed through sharing of similar air. Sexual activity, great way of passing the coronavirus if somebody is infectious. However, they also bring up the idea that there is fecal transmission of the virus, and that is that the virus can be found in poo. We know this because we use that to check communities, that they're looking at the sewage system to see if there is COVID in the poo of the sewage, then people within that area are probably also infected with coronavirus. And also they look at some studies that showed the presence of the coronavirus RNA within semen. Now, they do highlight that they can't be 100% sure whether the fecal transmission or the semen transmission could lead to an actual infection with the coronavirus, but they note it. So there's that. The letter then goes on to talk about the sexual behaviours that a lot of gay men have, in particular oral sex without a condom, rimming without a barrier in the arse there, and saying, could this lead to an increased risk of infection? Now, the letter moves forward to say that gay men might change the way that they behave and the way that they screen sexual partners. In particular, they might not just stop at saying, what's your status, or have you recently been checked for STIs? But they may also ask about, have you recently had any cold and flu-like symptoms? Have you had any fevers, coughs, and all of that sort of stuff? So screening for COVID. And it's an interesting hypothesis because I have said this from early within the pandemic, that the way that we have sex, but the way that anybody has sex, is an increased risk of the transmission of coronavirus. The letter goes on further to say that there is a chance that this will change the behaviour of gay men, that they're less likely to attend sex on-premise venues or places where people might congregate for sex, say parks or public toilets. I'm just not 100% sure on that. Like, currently with my own practice, I am treating a lot of people with STIs, which means that they're probably having sex. And anecdotally, I've seen a couple of patients who may have contracted the coronavirus through having sex with people who were infectious. So I'm not quite sure what this letter means from a meaningful perspective, or if it adds anything to the conversation, other than the fact that it does reinforce sex can lead to the transmission of coronavirus, and that gay sex may have some additional layers that could lead to a transmission of the coronavirus, but we're not yet sure if there's evidence that fecal coronavirus or coronavirus found in semen is capable of leading to a actual infection. But what I can say is that certainly within my community here in Melbourne, sex on-premise venues have been closed, and it is very difficult to maintain social distancing and COVID-safe practices within a sex on-premise venue. Some would say that it could be considered a super spreader environment, given that there can be a lot of people in a small space. And I suppose the question is, do we need to start considering asking the question about coronavirus? And this is a tricky one with the buddy bubble system that has been introduced in my city and my state. When you're about to meet up with somebody, we do need to consider the idea of, well, what's my particular risk for coronavirus? What's the particular risk for the person that you are about to catch up with? And maybe we should start asking the questions, have you had any fevers lately, sore throats, coughs, muscle aches and pains and things like that? I'm not 100% convinced that this letter adds a huge amount to the commentary, but it does bring up the question about, should we be talking with potential sexual partners, if you are having sex, about coronavirus symptoms as well? And I don't think it would be harmful to do that. However, it's not a guarantee that it will exclude a coronavirus infection, because we know that people are infectious before they get the symptoms of coronavirus, and some people can be infectious without any symptoms of the coronavirus. So it's a tough call, but I think the be all and end all of this is that sex is a great way of transmitting the virus, and gay sex might have a slightly higher risk of transmitting the virus, and we need to be aware of that. Anyway, I'll pop a link to the actual letter just below and have a read of it. And I'd like to know what you think about this particular letter and see what your thoughts are, because for me, it's kind of like, it's a yeah, but it doesn't really add anything in particular to the messaging that we've currently been doing. But I'd appreciate your thoughts. Have a great one. See you then. Bye.